Hello, I would like to discuss some OSHA standards relevant to the COVID-19 outbreak. While there is no specific standard covering COVID-19, there are some OSHA requirements that may apply to preventing occupational exposure to COVID-19. The first standard is the OSHA PPE standard. When exposure to hazards cannot be engineered or work practices or other administrative controls cannot provide sufficient protection, then PPE must be used. Examples of PPE that could be used for potential exposure to COVID-19 include eye protection, hand protection, face protection, and respiratory protection. Remember, if using respiratory protection, the employer should have a written plan and employees should be medically evaluated, fit tested, and properly trained. Another relevant standard is the General Duty Clause. The General Duty Clause requires employers to furnish to each worker employment and a place of employment which are free from recognized hazards that are causing or likely to cause death or serious physical harm. This means that employers should take necessary measures to prevent exposure to COVID-19. The bloodborne pathogen standard requires employers to protect workers from exposure to infectious agents. This standard applies to human blood and other potentially infectious materials by using universal precautions and other protective measures. Using the framework of this standard may help control sources of the virus, including exposure to respiratory secretions not covered by the standard. The OSHA record-keeping standard may apply to employees who contract coronavirus. COVID-19 can be a recordable illness if a worker is infected as a result of performing their work-related duties if all of the following are met. The case is a confirmed case of COVID-19. The case is work-related, and the case involves one or more of the general recording criteria set forth in 29 CFR 1904.7, such as medical treatment beyond first aid or days away from work. The chemical hazard communication standard applies if using cleaning and disinfecting materials. Employers must protect employees from exposure to chemicals by providing safety data sheets, employee training, and ensuring proper chemical labels on containers. The last standard mentioned in this presentation is access to employee exposure and medical records. Employees and their designated representative have a right to request relevant exposure and medical records. Medical records are personal and confidential and can only be released to the employee, a designated representative with authorization from the employee, or OSHA. Remember that medical records also have to be kept for the duration of employment plus 30 years. I hope this presentation was helpful.